Yes, thank you. And yeah, thanks for Lisa for chairing this session, and the reporters and everybody at the table that generated all this great stuff this afternoon. So it is 4:45, and we traditionally actually take a period at the end of this workshop for a few minutes to kind of reflect on the day. We've done some of that in this discussion that we just had, and we'll see in a minute if there's anything yet to be said. There may or may not be. And I'm certainly not going to summarize this meeting. That would be an impossible task, or reflect on it. I will just say that some of you know that our roundtable over these 3 years has been guided sort of informally or formally by a set of drivers that we kind of consider to be the drivers of population health improvement. Those include metrics, resources, policy, relationships, communication, and evidence. And as somebody just said, not all these drivers need new research. I mean, there's a lot that we can do and act on with what we know together already, and we need to get on with that. But there are places in some of the areas that you've just identified where new evidence across some of these buckets that rose from this conversation, alike about resources and metrics and relationships and communication, that are really essential to sort of move this field forward. And I know that research does not make policy, but as we've heard already, it can be extremely important in the policy process, as Lisa just mentioned. And I think that we really need to step it up and to increase our funding and our activity in this area to really, particularly on that kind of policy relevant research, that can sort of move our field forward, as we've heard about today. And as you know, I'm a huge optimist, and I think we're making movement, but there's days actually when I worry that the failure to do this, actually could be an Achilles heel of our movement. It probably won't fall on that because it has these other pieces that are in play, but I think we really, really have to step it up. And I think that what we discussed today ought to be a basis for our field, for the new association, for others to sort of move forward. I think Paula was adhering to kind of our limitations of our roundtable, but she might have been slightly too cautious in terms of, yeah, it's true, we do not make formal recommendations as a roundtable like a consensus study. So this will not be an IOM population health research agenda, but everything that the talks that we had today in the slides, the products of these discussion groups, including the things that raised to the top as priorities, including Paula's terrific 3x3 little box that I thought that is a way to think about where the priorities might be, the results of the survey, whether or not she gets it published elsewhere. I mean, these will all be a part of our workshop summary, and they will stand as certainly, if not a formal research agenda, things for people to work, other organizations and people in this room to work on. So I just think you've done a great job today in bringing that much forward, and we're deeply appreciative of it. I will call, one of the things that in these workshop summaries, actually the conversation that takes place at the end of this meeting right now is what we've had already, and we could continue, actually will appear in that summary, and that's one of the reasons we have this little section at the end. So I mean, if anybody feels called to, I may have sensed some tiredness in the room, but if anybody feels called to say anything else, perhaps more broadly about what we are about today and the importance of our topic, advancing science to improve population health, I would take a few more comments from the floor before we formally adjourn, if there are any. So let me at least welcome you to do that. but I was sensing actually that I was sensing already that a lot of the last conversation had picked up on some of that already. So it may be that we're done for that part of the session. Let me remind you that the videos, the presentation, and the materials will all be on our meeting page, website meeting page, NIS.edu/pophealthscience, and on the Roundtable webpage, IOMnationalacademies.org pophealth, the place you can find all of our wonderful materials. And I want to thank, and do you want to, are you standing there to say?
Go ahead and then I'll add something. Go ahead and then I'll add something.
And I want to thank again, everyone who participated, the planning committee, the speakers, the moderators, and our IOM staff, who include Lena Bachu, Darla Thompson, Colin Fink, Amy Geller, Lila Hernandez, and Tina Ritter. So unless there's anything else, go ahead.
One final note, in case you didn't see this postcard out there, this references the release today of our workshop summary on modeling and its use in population health improvement. It's available for free download as a PDF. We'll have the books in about 2 or 3 months. But if you want to download it, grab one of these and please do so. Thank you, and spread the word.
Okay, and that's the report of a workshop we held this spring. So again, thanks to everybody, and a very stimulating day. I think lots of material for going forward in our field, and thank you very much, and travel safely wherever you're going. Thank you so much.